My name is Dr. Erica Steele, and I'm a board-certified naturopathic doctor as well as a certified functional medicine practitioner. We'll be speaking about our functional laboratory testing here at our practice. We offer a CLIA-certified lab within our office. We run basic as well as advanced laboratory functional testing. We can pretty much test just about anything. I can test liver function, hormones, I can test food sensitivities, food allergies, neurotransmitters, genetics and methylation, just about everything. Because of my subspecialty in laboratory diagnostics, I know which labs to run, how to use them, how to read them, how to evaluate, as well as how to treat based off of them. In fact, a lot of allopathic medical doctors within the area refer patients to me as a result of my advanced skill in reading and assessing laboratory diagnostics. In our CLIA-certified lab, we offer our basic as well as advanced laboratory testing. Our basic labs are drawn by our phlebotomist within our office and then are picked up, and we receive them in about 48 hours. We offer those labs that can be covered by most major medical PPOs, as well as we've contracted and negotiated very affordable rates for our lab testing. Our basic lab panel, which is a comprehensive wellness panel, covers your liver function, kidney function, immune system function as fully, as well as thyroid and lipid panel. That panel, all of that panel would normally be around $500, and we've negotiated down with the lab to $97 for those people that either don't have insurance or aren't wanting to use their insurance. So all major PPOs will accept those particular labs as well as some of our functional labs as well. Every lab insurance is different, so we want to make sure that we check those ahead of time. So our functional laboratory testing I typically do after the basic panel. That basic panel, I take those results and I create a 20-something page report, and I go over those lab work with the patient at a review of findings appointment in detail. So I can assure you that nobody has reviewed your lab work as comprehensively as I do. I go over exactly where you are with your health. I also go over nutrient deficiencies, accumulated toxins, overall organ health and function, as well as methodologies to prevention. Your medical allopathic doctor is going to look for and identify and diagnose disease processes within the body. So oftentimes people that come to me, they say, oh, my lab work looks great. I've been to every doctor under the sun. Everything looks good. I'm totally healthy. Well, an absence of symptoms does not necessarily indicate good health. Remember, allopathic doctors are medically trained to look for and identify as well as diagnose a disease process. Naturopathic doctors such as myself, we're there to look for and identify the health of the body and then build the health. We want to decrease the toxic load, decrease the disease process, as well as increase the health of the body to bring the body back into balance. Obviously, if a person is healthy, the higher the health, the better the body. The person that's not healthy, the higher the disease, the more unhealthy that they are. So it's important that even if you don't feel any symptoms, that you actually participate in regular annual review of your lab work. Another thing that I'm specially trained in is epigenetics and methylation pathways. A lot of people are not trained in how to read the 23andMe or all of the full genetic panels. So using customized software, we're able to not only look and evaluate that particular information, but also create a designated treatment plan to stabilize such genetic variants as MTHFR, SOD, nitric oxide, which uncouples to create hypertension. There's a lot of different mechanisms that we look at for that. So people that, let's say, have a family history of diabetes or Parkinson's or dementia or any of those particular larger diseases, it's important for them to have an understanding of where their genetics are. Just because you have a genetic variant to something does not mean that you're going to manifest disease process. Again, understanding with the specialization of laboratory diagnostics and the science and art of it is really important so that you can create targeted treatment options to prevent disease rather than trying to manage the disease process. Holistic family practice, we bring care back to healthcare.